Good morning. Mayor Dan Pope this morning on a very different, but regardless, Coffee with the Mayor. So welcome. Thank you for taking time to join us this morning. Happy New Year to everyone. And I think we're glad to get to 2021. This month would have traditionally been our, what's nearly always at Amigos on North University. It's our, we move, as you know, we move our coffees around. It's time to be in District 1 with Councilman Juan Chávez, who is co-hosting with me this morning. So Juan, I'll turn it over to you for a few words of welcome, and then we'll get started.
Thank you, Mayor. Good morning to all that are joining us. Hopefully 2021 will be much healthier than our 2020. 2020 has been very impactful to our families, our loved ones. My condolences to each and every one of you that have lost your relatives, your loved ones to this COVID-19. It's a disaster for our community. We've all been impacted. I have personally, my friends, relatives. I continue to emphasize wear your facial coverings, maintain your social distancing, get vaccinated. We'll get through this. But as a community, we've got to be together on this. I've received countless of questions about COVID, about vaccinations, about herd immunity. Much of this is medical, in the medical field. I won't even delve into that. That's for, I guess that would be for the people that are making the big monies. And with that said, again, thank you for being here. Thank you for participating. Thank you for being active in the community. Thank you, Mayor.
Thank you, Mr. Chávez. This morning, we're fortunate to be joined by City Manager Jared Atkinson, City Secretary Becky Garza, and by City Attorney Chad Weaver. We also have other key city staff leaders of city staff leaders that are on the call with us today. They're maybe not panelists, but if we need to promote them to answer a question, we certainly are able to do so. So I think what we'll do from a format standpoint, Abby, is you've gotten several questions that have come in, a handful of questions maybe. I also asked you and Mr. Goodwin to put together a list of sort of the top hits of questions that are coming in via phone and email to the City Council office. Thought we'd try to address those. And then if we have some time left, we will allow maybe a few questions to come in via the chat feature. I would just start by reminding everyone that we had our first council meeting of the year last Tuesday night. It was had a long council meeting, had a very, very good meeting. The work session that night, I think, was interesting at a couple levels. One, we had a very good report from Lubbock Police Department. They looked back at 2020 and gave us some data about 2020 and looked forward to 2021, talked quite a bit about how they're reorganizing to be ready to move into the police substations later this year, sort of the flattening the organization. Remember that the idea is to get those resources closer to our homes. And Chief Mitchell and his team did a nice job of laying that out. And certainly you can watch that on video on demand on the city website. We also had a presentation about the Unified Development Code. And I'm certain we'll probably talk a little bit about that as we go through our questions today. And then we had a good COVID update too, as to where we are with COVID. And a lot of that data we'll probably chat about today. We meet again next Tuesday night. In work session next Tuesday, we'll have a couple of, I think, really important topics. One that came straight from our planning meeting in November, and that's to talk about the city charter and some ideas around a potential charter election. The second will be to get an update on our public safety improvement project. So that's the three police substations I mentioned, the downtown police administrative headquarters, the municipal court, and the crime lab and property warehouse. So we'll get those two. Those will be done before our council meeting and work session next Tuesday afternoon. So I'll pause there I'm going to get a drink of my coffee. And Abby, why don't you ask us a question?
Great, thank you, Mayor. One of the questions that was submitted to the citizen comments inbox is regarding, as you probably know, the vaccine, and that's kind of the top of everyone's mind, at least this week. And so the question was, I just want to make sure we get our second dose of the vaccine. How can we do that, and what can we expect for the second round?
That's a really good question. We're starting to hear that a lot. So I'm going to ask Mr. Atkinson to come live here with me, and we'll work on answering this question together. So in the city vaccination clinic, we are using the Moderna vaccine to date. And that vaccine requires a second shot or a booster 4 weeks after the first shot. Now, the first day we ran the city vaccination clinic was the Monday after Christmas. So I believe that was December 28th. That means that next week we will cross that 4-week threshold, and the very first folks that were vaccinated at the city clinic will get their second dose. I'm going to let Mr. Atkinson talk about the details of that and how we're going to contact you and how we know the supply is there. But suffice to say that our planning includes not only first doses, but also second doses. And most importantly, I think to our citizens, we need to realize that we're not going to slow down our first dose, vaccinations to get the second dose. We're going to be able to do those concurrently. And we expect the pace of vaccinations to pick up quite a bit. And we'll talk, I'm so sure about that some today. So Jarrett, you want to fill in a few blanks on that, please?
Certainly, Mayor, thank you. So as far as do we know that we will get the second dose? The answer to that's absolutely yes. So if you'll notice, the last 2 weeks, we've received 5,000 doses a week. We had smaller allocations earlier. Each of those dose 1 allocations is an automatic dose 2 allocation that comes in with it. We're not holding those today. As the mayor said, they begin to arrive to where we can use them the week of January the 25th. So we will have them. The assurances continue to flow into us from all the various state agencies. We know our hospitals actually started with Pfizer vaccine about 2 weeks before we were able to start with Moderna. And most of them have finished their second dose allocations. Their doses arrived just as scheduled, just as promised. So the doses will be available. How are we going to do that? We will begin to make announcements by the end of this week with very specific details. We'll likely use our same systems that we have today, but on a different number, so that we're only fielding those that are due and eligible for the second dose. We will continue to run our clinic at full allocation for first dose. So 5,000 this week. We expect 5,000 next week, but we will have a set aside that is in addition to that to bring in our second dose people to be sure that they get the vaccine that they need. I think I would also remind everybody, as Mayor Pope noted, you become eligible for your second shot of Moderna 28 days after the first shot. That does not mean that you have to have shot number 2 on the 28th day. There is actually a couple of week-long window that the manufacturer has advised us of in there. So you will get your shot. We will make arrangements. You will not have to go back through the waiting queues that I know many of you did in order to get your first shot, and it will happen. So, Mayor Pope?
Just to add to that, we want to make sure that and why we were tracking everybody that's vaccinated. You're actually logged into a system after you're vaccinated, because we want to make certain that if you got the Moderna first dose, you get the Moderna second dose. If you got it from the city, that's what we've been doing. But if by chance you were vaccinated somewhere else, you don't need to come and get the Moderna vaccination from us if you receive the Pfizer vaccination somewhere else. Juan, is there anything you want to add to that, or if you feel free, if you feel like you want to message any of this in Spanish, you're welcome to do that also, Juan.
Thank you. I appreciate that. Jarrett, on the second dosage or the second vaccination, the public will be reached out via telephone. How is that being taken care of?
We expect that we'll have both options, a select-a-seat queue that is unique to the second doses. It will not compete with the first dose allocations, as well as phone lines. If people are not for whatever reason signed up to get their second dose, we'll reach out to them directly and advise them, hey, your time is coming. If you're able, you could come on Thursday, whatever day it might happen to be. And Mr. Titus, to kind of add to that, and really builds on Mayor Pope as well, by the time we're into this 3 more weeks, your city vaccination clinics will be running at roughly 10,000 doses a week. That's your 5,000 first doses. We do expect the state to maintain its commitment to us to have that. They'll back that up with the 5,000 second doses. When we get to that, we're actually looking, by the time we hit 10,000 doses a week, we're looking at adding a 4th day to do that, really just to help people not have to wait so long. But we will, if somebody's unable or does not remember to get in line for dose 2, we will reach out to them.
Thank you. I'm going to try to do a little translation there. Para todos los televidentes que están escuchando hoy este día, buenos días. La coronavirus ya ha sido vacunado por la primera dosis. Le van a llamar, que es tiempo ya para ir y hacer su cita para la dosis número 2. Y el dosis son 28 días después de la primera, pero no es necesario ir exactamente el día 28. Le van a llamar en tiempo para poder ir y hacer su cita para que le den el dosis número 2. Muy importante que vaya y se vacune la segunda vez. Gracias. Thank you, Mayor.
Thank you, Mr. Chavez. Okay, Abby, back to you.
Well, we have another vaccination question. This one is regarding earlier this month, local and state media outlets reported that Texas's supply of the COVID-19 vaccinations were insufficient to cover all of individuals in phase 1A. As a member of phase 1B, would it be unethical to jump in line? Since there's a shortage, we want to make sure phase 1A is vaccinated before phase 1B. And so the question was, how are they doing this and getting 1A vaccinated before 1B?
Okay, I'm seeing looks like we had a chat from maybe the citizen who asked the question. Here's my take on that. I'll let Jared add to it. I think there was a point where we did not have enough vaccine supply to cover all of 1A. I think we're well past that today. At least the 1A population that wants to take the vaccine. I think the number that the governor talked about yesterday was 1.7 million vaccines that have been given. His numbers lag a few days. We know because of the reporting. But my understanding and that the reason that they opened it to 1B was that instead of we got to the point where we had vaccinations sitting on the shelf and we wanted to make sure that we got those in people's arms. Now, there are still some 1As that are trickling in, but the vast majority are 1B. And I think it's also important to note that at our vaccination clinic, 1As don't have to make an appointment. We've got a way, they sort of have like an express line to come in and get their vaccination. And we're still picking up volunteer fire departments from around the county as an example, but some hospice home health folks that maybe have not been vaccinated. But that's my response to that. Jared, you want to add to that?
I think it's well said. The move to making the 1B population eligible or open for vaccination was actually done by the state. That was not a decision made locally. As the mayor said, and this was, remember that the Pfizer vaccines came in first and came in very large quantities. And then quickly thereafter, the Moderna vaccines began to ship. And what the state was seeing was vaccines that were at provider offices, whether those be hospitals, pharmacies, clinics, whatever they might be. and they were not being administered. So they opened the 1B eligibility. That's where we stand today. Any 1B person is eligible. We do run the express lane, as the mayor noted, for the 1As. Any 1A eligible individual that can hear this press conference in Lubbock is more than welcome to come up. We'll get you right in to do that. That number truly has really slowed to a trickle. We actually held some early clinics just for the 1A eligible people and ran hundreds through to try to help with that effort. Mayor?
Thank you, Mr. Atkinson. So we just had a chat question that came in that I think is a good way to keep going on vaccines. So the question was how long before the general population will get vaccines? And I don't have an answer for that. My best guess is that we're probably maybe 4 weeks out for that. We do expect supply to continue to pick up. And I think it's important maybe that we talk a little bit about some of the planning we're doing around that. Mr. Atkinson talked about doubling our throughput, or maybe even more than doubling our throughput at the city vaccine clinic to be able to still put in 5,000 or 6,000 new vaccines a week, as well as be able to do that many second doses. We think that in early February, based upon some conversations with the state, we will start to receive more vaccine. And we're working closely with folks like United Supermarkets, where they've actually come up with a relatively creative plan. They're working with the state on that, not only to help Lubbock, but to help the region. We're working with Texas Tech and the Health Science Center and with Covenant and UMC to make certain that when that vaccine supply increases, that we're not caught off guard. So I think, you know, that good news is coming, and we're planning on getting to that. Jarrett, what would you add to that?
First, we expect next week the number of doses that the state has to allocate each week goes up by 100,000. And then following that, so then we get into the first week of February, it goes up again. So the vaccine pipeline is filling up. Supply is really beginning to move. There are 2 more vaccines that are pending in Washington to be approved, to be released, that will increase the supply just, I would imagine, a minimum of doubling the supply. So supply is really coming. As the mayor said, we are now considered a hub. That's what we're doing at the Civic Center. We're looking at plans to submit to the state to really take us above the 5,000 a week. We think 6,000 first doses, 6,000 second is well within reach. The partnerships that we have here in Lubbock, your community working together, are putting us in line to submit to receive allocations of several other thousand doses that would come in. And these are things that will happen in early to mid-February. So there's a lot happening in the background. It's all contingent on, number 1, receiving an allocation from the state, and number 2, having that allocation guaranteed. So as the hospitals, as United Pharmacies, as they ramp up to be able to put doses out in a large number, they've got to have the surety that we'll do that this week, next week, and the week thereafter. But to go back to the question of when does the general population become open, you know, as the mayor said, right now, nobody is able to tell us that. The most common answer is we're looking at late March, early April. If these new supplies come online, it could well be earlier than that. So March might well work, but my guess is a little toward the end of March.
I'm probably a bit optimistic. Juan, you want to add anything on that? You want to add anything on that, Juan?
No, just asking the public to be patient. And when that window does open up, get on that phone, get on the computer, make your appointment, and the process, the procedure is fairly painless. I went in, I think I was the longest part was to sit down at the chair and let's wait 15 minutes, make sure there's no adverse effect to the actual vaccination. My wife and I were out, like I said, probably from the car to return to the car within probably 20 minutes. Slight discomfort to the wife on her shoulder. overnight. I had no side effects. I mean, we had no side effects other than slight discomfort on the shoulder. But rest assured, we're doing everything that we possibly can to make everybody vaccinated. Thank you.
Thanks, Juan. So I saw a question come in about how are we staffing the clinic. I think it's a great opportunity to talk about that. So I'll start. Jarrett, you help me. Okay, we've got great partners. Let me start with that. We've had a combination of school nurses. The first week we were doing our mass vaccinations, or the second week it was before K-12 started, and we had one day we had LISD nurses that helped us pretty much all day long. We have some retired nurses that are coming, basically have raised their hand and say, we want to help. We have used a number of city employees to help. They're not, we have our Lubbock Fire and Rescue EMTs doing vaccines. We have other city employees doing the paperwork. If you've not been yet, when you get vaccinated, there's a 2-person team there. There's one that's doing the vaccine and one that's doing the paperwork. We found that it allows us to move very quickly. Last week, when I was at the vaccine clinic, we had a number of Texas Tech med students there. In fact, these bright young, then they're in their scrubs helping out. I don't know how many, there were probably 40 or 50 of them. I talked to Dr. Rice Spearman, the president of Health Science Center, yesterday, and she talked about how excited they were to be able to help. You look around, you had community physicians there. Doug Klepper, who's a local pediatrician and is the public health authority for the county, was there that day doing vaccinations. So, so far, we've been able to accomplish what we're trying to accomplish with our folks and good volunteers. Now, we know we're going to have to ramp that up. And I know Jarrett's been working a little bit on that. The hospitals have suggested they can help. Jarrett, you want to take it from there and maybe fill in a few gaps?
Excellent list. I would only add one more to it. We do have various church groups that are reaching out to us and providing volunteers. Excuse me. So, to this point, it's all been handled at the community level and at the city level. The volunteer groups that we have pending, we think are sufficient to carry us up into that 10 to 12,000 a week. We're always looking for more. If you're interested, you can work through our emergency management department. We've activated what we call volunteer management. It's part of your regular emergency planning. And that is 775-3401. Or the easy number is always 311. And ask for emergency management, and they'll take you down and contact you, when we're ready to have that help. But, again, you can't compliment the community enough. Organizations that we've asked have said absolutely. Organizations we have not asked have called and said, we're here and we're ready. If you go in there, it's actually, compared to the total staff, a relatively small number of true medical specialists. The medical community, well, we have no shortage of people to actually administer that vaccine, but for every one of those, we probably have 5 individuals that help people get in and out, that help with the intake, the paperwork, get you a glass of water, help you move if you need to move around, mobility. So it's working very well. A lot of that clinic is a very scaled up version of longstanding plans that were in place for other pandemics and situations. I think the difference here, we never expected we'd still be at it 10 months later. So, Mayor?
Yeah, two things I want to add. And Abby, if you could promote Chief Fogerson. I think he's out. I want to ask Sean to comment here in a minute, but we couldn't have done this without great work from the health department and their leadership. And they've done a remarkable job, and they keep tweaking the vaccine clinic. The way we operated early on is a little different than today because we've continued to learn things, and we try to build those efficiencies into the process. I was there last week, and one of the city employees came over and introduced himself to me, and he works at one of our museums. But because of where we are in pandemic and not having a full requirement at his regular job, he was asked to come over the first week that we did vaccines to help out, and he stayed over helping out in an administrative role. But he just told me how excited he was to be doing that. We couldn't have done this without Lubbock Fire and Rescue, and I thought we might get Chief Ogerson to come on and talk a little bit about how his team has responded and what their what his take is, having watched that. Sean, are you with us this morning?
Chief Mitchell just said I could not get on his laptop, so he's on his desktop, but it does not have a mic. So he is here and he is on the Zoom.
Chief Ogerson is?
Chief Ogerson or Chief Mitchell?
Yes, Chief Ogerson, excuse me.
Okay. So
Chief Ogerson, if you can hear us, log out and maybe come back in on your cell phone, and we'll have audio rather than video.
Yeah, and we'll come back to the Chief if here in a bit.
Mayor,
please.
If I could add on to that, while Chief Ogerson gets back online, when I went in, or when the wife and I did it, like I said, it's so well orchestrated. I was directed to a table, and of course, LFR is there. Very comforting, very knowledgeable. The person explained what they were fixing to do. I thank LFR for being there, for stepping up and helping the community. And Chief Ogerson also for his leadership. LFR has been doing an excellent job throughout this entire epidemic or pandemic. Thank you.
Thank you. Thanks, Juan. Jared, one of the questions that we had come in was pretty interesting. I thought it said, how did, and you have a lot of background in emergency management. How did our response to the swine flu, city's response to the swine flu, or other, situations like that, how did that help shape the way we're responding to this?
Good question. And what those prior pandemics, what those prior plans really did was give us a base from which to start. So the concept of providing mass vaccination in the plans, it's actually called a pod, a point of distribution. They go way back in emergency management. Every time anything happens, you learn and you adjust. It really kind of set us in place to be able to start this and then scale it up and learn how to make it work. So really a lot of this response, the concept of contact tracing, the logistics of providing PPE and testing, those all existed. They didn't exist with an expectation of how long, of the duration. That's really been, what was different here. And then trying to scale back up to do that. Mayor, if we could get maybe Ms. Dye to send the chief a new set of credentials with a password, he's where he could log back in.
Okay.
As he's doing that, Mayor, if I could, I want to, continue to add a lot of compliments to LFR, besides helping us with literally doing the vaccine, with providing the 15-minute medical observation. The men and women of Lubbock Fire Rescue have been just involved in all aspects of this. They have run our big city testing clinics. They have been first people in to go into the nursing homes early on and provide the testing there. So, we think of those folks in the stations and in the trucks and helping us out with an auto accident or a medical emergency or a fire. And they've continued to do all that, plus all of the skill and all the dedication they've brought into the pandemic. And I think the chief's logging back in. Mayor, I'll give it back to you and we'll catch him here in just a minute.
Yeah, so before we leave the pandemic, and I think we'll probably have a couple more questions, but I think maybe it's a good time, Abby, to talk about where we are with the overall response. So 2 months ago, on December 19th, I believe, looks like Chief Ferguson's raising his hand to come in maybe. We had 320 people in the hospital in Lubbock for COVID. A month ago, that number was down to 240. And yesterday we reported 195 folks in the hospital with COVID. Now, that's a result of fewer positives. And we're seeing our trend line on new cases go down too. And we'll report some new data today at lunch with our weekly press conference. We can't afford to let up. We want to continue to, Juan talked about it a while ago, wear your face mask, be careful who you hang out with, wash your hands. We need to get our hospitalization rate down below 15%. And we are in the 20% range. Yesterday when we reported, the state number was not up yet. Jarrett, do you have a new state number?
I'll check, Mayor.
Okay, right around 20%. And that means that 20% of our total beds are filled with COVID patients. We need to get that below 15%. When we do that, we can expand our restaurant capacity. We can reopen bars. And I think we can start thinking about, at a city level, opening some of our facilities, maybe starting to have some meetings face-to-face. Okay, Chief, good morning. Glad to see you.
Good morning, sir. It's good to be here. I'm not that slow responding to a fire, I promise.
That's good. Tell us a little bit about what it's been like from your perspective, particularly through y'all been involved in this all along, but particularly during the last 2-3 weeks as the vaccination efforts, not only putting shots in arms, but helping through the wait process and just all your team's been doing.
Well, sir, the first thing that comes to mind is just the blessing that it has been for us to be able to contribute to the effort to get back to normal. Of course, it's been added responsibility, but when we all sign up for this job, we do so to serve, no matter what that looks like. So, we've been beating the bushes, getting volunteers out. A lot of our members have had COVID, so they know what it's like and they want to help prevent that. But it's also reduced our manpower a little bit because of the time period it takes when those people are sick or exposed. One, to make sure they don't have it, or if they do have it, to give them time to recover. So, but we've been very lucky and we've been able to staff those positions. And like I said, we're just happy to contribute, to be able to use our skills as EMTs to get that out and just help us get back to normal.
So, Chief, one question that might pop up to someone would be, well, if we've got that many members of Lubbock Fire and Rescue at the Civic Center, what happens if we have a fire or a medical emergency otherwise? Explain a bit about how you're staffing.
Yes, sir. We have 19 stations around the city, geographically spaced. At any one time during the clinic, we've only had about 2 in-service units down there. We've done the rest with volunteers who have come in while they're off duty. We've also rearranged some staff positions to make sure that the city's adequately covered while we're serving down there at the Civic Center. So really don't have any concerns about coverage. We've rotated crews in and out to make sure, if you were up all night on medical calls or at a fire, you weren't sticking a needle in someone's arm to make sure we had the right people there at the right time.
Thanks, Chief. Great. We appreciate you guys very much. Mr. Childis, you have anything for Chief Fogerson before we let him go?
Yes, Chief. Again, a thank you to you and all of LFR. Great leadership. It's a direct reflection, your leadership, direct reflection on the people that are there. Great job. Well done.
Well, thank you very much, sir. I will pass that on, and we're just grateful for the opportunity to be involved. This is really nothing like this has happened in our lifetime, and it's great to be a part of it. So thank you very much.
Thank you, sir. Appreciate everything you guys are doing.
Thanks, Chief. Thank you. Okay, Abby, let's go back to another question.
Okay, we did get a follow-up question regarding vaccines, but it says, is there a threshold for vaccines administered before we start opening up or before the percentages start to change?
No, we've not really talked about anything like that. I mean, we need to measure outcomes, and we're a long way. I mean, if you start doing the math, we probably have we have 270,000 residents. We've maybe done what, Jarrett, 3,000 to 5,000 of our 1A group has had, maybe a little more than that, had 2 a little more, had 2. are fully vaccinated. Jared, how would you answer that question? I really hadn't thought through it from that perspective.
I'd go right back to the start. So there is criteria for reopening, and it is not associated with the uptake, the percentage of the vaccines that are administered. The criteria for reopening is set out in one of Governor Abbott's executive orders. And it is when our hospitalization rate goes below 15% for 7 consecutive days. And we ended up in our most recent report, just a tiny bit over 20. We've been as low as the high 18s. We've been as high as the low 30s. But that hospitalization rate that reports every evening, that's what we need to watch. The closures or the reductions in occupancy that are in effect today actually do stem from the state orders, not from any local orders. And they're all entirely based on that hospitalization rate.
Abby, I think we had a question somewhat related to that. Do you want to take that? You want to ask that question, please?
Yes, sir. So this question was submitted via the citizen comments email, and it says, who at the city, county, or state level is tasked with monitoring and enforcing the 50% occupancy requirements for restaurants and other public places in Lubbock as prescribed in Executive Order 32? So this is more about enforcement.
Yeah, so I'll start on this and I'll let Jarrett finish. Our approach from day one has been to be very active and very present in the community. I mean, I can remember on a Sunday in March that the police chief and the fire chief and Mr. Atkinson and Councilman Massagill and myself visited a bunch of our big box stores. We continue to really, with the LPD and with the fire marshal's office, to go out as people call us and say, hey, I was at so-and-so. It looked to me like maybe they're over the 50%, or maybe even we have a business call and say, I need some help interpreting this. Can you help me make sure I've got this done the right way? Remember that there's not a remarkable amount of enforcement capability in the governor's order. And I think that's done by design. He expects that Texans are smart enough and conscious enough for their neighbors to do this the right way. And we've had very few challenges in that regard. Now, when it comes to those that have liquor license, the state does have enforcement. And so that would be your bars and restaurants, and TABC owns that enforcement. And they were very active in Lubbock in December. They made, we're here for several weekends to do a bunch of visits to local establishments, just to remind folks what the rules actually are. Jarrett, what would you add to that?
I think that was perfect, Mayor. Nothing else to add. At the state level, it's the Texas Alcoholic Beverage Commission. At the local level, you're welcome to contact us. Our fire marshals, Lubbock Police Department, Environmental Health Department primarily are the ones that will go out. And as the mayor said, our focus is really to educate and encourage rather than to enforce. And we've had very good luck with that.
Yeah, and remind me what that non-emergency number is at LPD if somebody wants to call that, Jarrett.
Just a second. That's the one that just jumped out of my head. Abby,
as he pulls, go ahead, Abby. Do you have it, Abby?
It is 775-2865. And Allison, thank you. You got that about the time I pulled it up.
So here's just a bit of common sense advice. And I saw one of our followers this morning said the same thing. He said it a little different way, but I really believe that we make the decisions about where we go and how safe we feel. And we need to, we choose with our feet and our pocketbooks. And if you go into a restaurant or to an establishment that you feel is too crowded, then turn around and leave. Or take advantage of curbside delivery. Take advantage of takeout. Jarrett and I were talking just yesterday about a business that and how they had, the takeout line, and We used to think Chick-fil-A was the best. I think they still are, but there are a lot of other businesses that are starting to master this idea of drive-through and takeout. And, often they've reserved the very best parking places right in front of the door for people that want to do takeout. So continue to support our local businesses. We need them there when we look up and say, wow, things feel normal again. But do it in a safe way. Okay, we're on a great trend line right now. Really, really a good trend. The nation, week over week, this last week we just finished, there were 16% fewer new cases in the country than the week before. We're a better spot than that. We're definitely on the downslope. Now, we know that K-12 has been going now for 2 weeks, that our colleges begin in earnest this week. We're very cognizant of that. We can do this. We have to take the precautions that we've been taking, stay the course. Okay, sermon over. Abby, back to you.
Thank you, Mayor Pope. Going into that, as we start getting into the spring and early summer, which is crazy to think about, we've started getting some requests about when will outdoor events be able to be approved? What does that process look like? Do we have any updates on outdoor events?
So the process today still remains that it's in the city, it requires the mayor's approval. In the county, it requires the county judge's approval. That's any outdoor event more than 10. And so we really are not approving many of those right now. The good news is we're not having many requests for those on, yesterday would have been if you wanted to have an event outdoor yesterday, more than 10, you might not have had that many people show up. But we will start to see good weather soon. And we hope that we're in a better position. Once again, it's that hospitalization rate. Let's get that thing down to the point where we can start looking at safely doing some outdoor events. We had a request, a request we want to be able to say yes to, that's for the latter part of April. We're going to hold on that for now until we see how we stand. Jared, you want to add anything to that?
No, sir.
Got it? Okay.
Got it.
All right, good. Okay. What else, Abby?
We've also been getting several questions about the downtown park. This was discussed in a work session, I think, at the last council meeting. And so if y'all have anything to share about the downtown park and the planning process going along with that.
I'll start on that. I'll let Mr. Childis add to that. In a downtown civic park was called out as a key part of our downtown redevelopment. We accepted the plan from our consultants during the pandemic. I've lost track of exactly when we accepted their plan that was the Overland Group. That park is planned to be in the block where the old LP&L building was, Lubbock Business Center. This year's budget includes money to both do planning for that park as well as to tear down the existing building. That money is funded from monies raised in the downtown TIF area. So it comes from the downtown TIF budget. Basically what that means is that the growth in value and the property tax associated with that in this defined area is reinvested back in that area. So it's being reinvested back in downtown for that. That's as far as we've gone from a standpoint of planning. Now, we're putting together a citizens group to work closely with the consultants that we selected a couple meetings ago, and they will begin to work on a plan for a downtown park. I believe that downtown and a park downtown is sort of like the family room of a city. And what we're trying to what we envision and what we're trying to do is build a park that brings everybody together, that helps connect our city. All ages from all parts of town, with things that will be attractive to kids and to adults, with live music, with restaurants, with just a very dynamic type of environment, not like any park we have, nowhere near any park that we have, much more like Warren Park in downtown Dallas, or maybe the park in Houston. I can't remember maybe they call it Centennial Park. I can't recall. Or the park development at the Pearl in San Antonio. Those are the sort of the what we're shooting for. It'll be, from a funding standpoint, it'll be a public-private kind of funding situation when it comes time to build the park. We're not there yet. We'll make those decisions in public, but we're looking forward to the day, and we're getting closer to it every day, that when people fly into the airport, if you go pick up a friend who's never been to Lubbock, or maybe somebody you're recruiting for a job, that instead of avoiding downtown, the first thing you do is take the downtown exit and drive through and show them what a happening part of the city downtown is. When we go to visit a city, rarely do we say that's a great place to go visit if they don't have a good downtown. And I think about Fort Worth, or I think about Omaha, or I think about Oklahoma City. Those are cities that, we're not talking New York, Chicago, Houston. I'm talking about cities much like us that have invested in downtown, where people want to live and work and play. That's part of the next step for our community. And it's something that our council has been very supportive of. Juan, you want to add anything to that?
I'll add a little bit. You pretty well covered all the bases on that one. The vision, the destination. When I see downtown park, the vision of going downtown, sitting at the park, listening to some music, food trucks, restaurants, a great environment. I mean, right now, like you said, the vitality, the park in the downtown area would be really great. Again, the destination, the music, the restaurants, food trucks, maybe even a waiting park. We are pool. We haven't gotten that far yet. The advisory group that's already been put together, meetings with the community, trying to figure out ideas. That's what we're looking for. I think this is going to be really, really good for the downtown area.
Thanks, Juan. Thank you. Yeah, I appreciate your willingness to serve on that, help lead that advisory group too. Okay, Abby, I think we've got about 5 more minutes. What kind of questions, what else do you have there for us?
We've been giving some what you would call normal calls up to the council office regarding potholes or reporting codes cases. And so, we have the new city app. And so I didn't know if we could just remind citizens about that app, and that when they see something, they can report that on our application.
Yeah, so let's talk about the city app. Abby, if someone wanted to get the city app, or Jarrett, what's the best way for them to do that?
So I have the app on my phone, and you can go to your app store, and it's the My LBK app. So you can just type that in, and I'll type it into the message box. But the other day I actually reported, I think, a loose dog in a neighborhood. And so I sent that in, and it was really easy. So it's just nice to be able to report that if you're someone who doesn't want to call in and talk to anybody.
Yeah, so when you open the app up, this is the first screen that you see. And it says, submit a report. Let's just click on that, submit a report. And then it's going to ask you to add a photo. Okay, it's a remarkable ability to report data quickly and to connect to the city quickly. And I think it's something we rolled out during the pandemic, and unfortunately, we're going to have to go back and re-roll a number of things out and remind people that we have them, because the noise has been so loud around pandemic and around national election, peaceful transition of power, that some things have gotten lost in the wake. This is a really very valuable way to communicate with the city. Okay. Now, if you don't want to do this, then you can always call 311. And if you call 311, then we want you to tell us what your problem is, a pothole or a your trash hasn't been picked up, or maybe a codes issue, you're going to get connected from 311 to that department where you can then talk to someone who can more readily address your questions. Jarrett, you want to add anything to that?
Please use the app. That app has a back end that works inside of here that allows us to track and to trace and to open and to close the tickets. So it provides a very good level of accountability. Glad to take your call through the telephone, through an email, but if you can, use that app.
Juan, you want to add to that?
Yeah, yes, I would. Well, actually, more of a highlight about one of our departments that a great venue to highlight, the codes department. They just did a sweep in the Slayton Bean neighborhood. There were 96 rubbish cases, 116 zoning cases, 24 junk vehicles, 12 property maintenance cases, and 4 roll-offs. Those huge dumpsters were filled. Again, codes department doing a great job out there, but we need to reach out to the community. The community needs to do their job as well. We're doing everything we can. Codes department, great job. Leadership up there with Stuart and everybody else. With Jessica, great job. Thank you, Mayor. Oh,
Thanks,
if I
Mr.
may,
please.
There will be other sweeps in the neighborhoods. We'll try to make that available, or that information available. Thank you.
Okay, Abby, one more question?
Sure. Let's see. Oh, I just wanted to remind everyone that it is African American Heritage Month for the City of Lubbock. You can go to the City of Lubbock website and nominate someone. And so I can put that link into the chat box, but I just wanted to remind people of that. And then Mayor Pope, I'm going to turn it over to you and Councilman Chavez for a final word if you don't have anything else to add.
Juan, I'll let you start.
Thank you, Mayor. Thank you, Abby, Jared, and all the participants. We need to hear from the community. You know, that's what it's about. We're the policymakers, but if we don't hear from the community, be good or be bad, we're here to do a job. I appreciate everybody that participated. We continue to move forward. Again, please wear your facial covering. Make your appointment, get vaccinated. Limit your exposure to other people. We're the Hispanic community, we're very, very tightly knit. We're forever having parties or celebrations, quinceañeras. It's unfortunate, but sometimes that's the outbreak of the families. We hear about it, we read about it, we're being impacted. We need to be the difference makers. Please, don't be a stat. Be the difference maker. Thank you, Mayor.
Thank you, Mr. Chavez. Good words. Let's just wrap with this. We're doing all we can to safely go about our business and keep the city moving, protect both lives and livelihoods, and that'll continue to be our goal as we go forward. Citizen input is a big part of everything we do. The city government only exists to serve our citizens. So we're doing this a little differently this month. We likely will do this the same way in February with more of a virtual kind of coffee. We may try a different time in the day to see if we get a different kind of turnout. But your input is still valuable. We're still here answering the phones, responding to emails. We've slowed down a few of our big processes we have going on, including the Unified Development Code, where we're rewriting zoning laws, guidelines. We're slowed that down to make certain that during these different times that we get the kind of input we need from citizens and from stakeholders. So thanks for being here today. Thanks for all you do. Please stay safe. Please stay hopeful. It is a great day in Lubbock, Texas, and we'll be back with you guys soon. We look forward to hearing from you. Thanks for being with us this morning.